Welcome to Healing Heroes, PDX, the podcast series from the specialists at Shriners Hospitals for Children in Portland. I'm Melanie Cole, and I invite you to listen in as we discuss how to become a patient at the Portland Shriners Hospital. Joining me is Amy James. She's a new patient coordinator at Shriners Hospitals for Children in Portland. Amy, I'm so glad to have you with us today, and thank you so much for joining us. You're one of the main contacts for all new patients and families. When a person calls to inquire information about the hospital, how do you determine that they could benefit from the care provided at the Shriners Hospitals for Children in Portland, and what does that process of becoming a patient look like?
So we make it really easy here at Shriners Hospital in Portland. A family can self-refer, or they can be referred by their physician or another care provider, even a friend. We get basic demographic information from the family, but in that conversation, we're also obtaining from them what it is that they would like us to evaluate. So whether it be flat feet, maybe their child's feet turn in, perhaps they have more complex conditions such as cerebral palsy, scoliosis, etc. We are listening to what their needs are and how we can best meet them.
Well, the Portland Shriners Hospital is obviously unique in the fact that you offer comprehensive care all under one roof, including rehabilitation services, a state-of-the-art motion analysis center, which is so very cool, orthotics, prosthetics, and so much more. How does a patient get access to those comprehensive wraparound services offered on-site at the hospital?
Yes, so once you become a patient here with us, you have access to all of those wraparound services. What we're listening for when you give us a call is that condition appropriate for us? And then how can we best meet your needs? So sometimes families give us a call and they're really interested in maybe obtaining a brace from our brace shop. So what we'll do is pair them with a physician that's appropriate for their child's condition. And then from there, they can possibly be molded and measured for a brace if it is appropriate for their condition that day, or they may come back to see us another day for another test with our motion analysis lab or with rehab if that's appropriate.
Well, then what should families expect when they arrive at the hospital for their first appointment, Amy? How do you ensure this process is as smooth as possible?
So like I mentioned before, we're really listening in on a lot of cues in that first conversation with the family. We understand that we are in a unique position to provide care to families coming all the way from Alaska, Montana, Idaho, Northern California. So it's not just the Portland metro area that we serve. So we're listening for things like, I'm taking time off of work for this appointment. I'm bringing in other family members to help care for my other children. So we want to make it right the first time. We're listening to you as far as this is what we're looking for in a physician. This is what we're hoping that you'll be able to help us with. So we pair you with the correct physician, hopefully the first time we get it right, to make your visit that much more enjoyable. Perhaps you mentioned to us that your child is fearful of a hospital setting, so that will give us the opportunity to talk to you about our child life specialists. They are our colleagues here who are specially trained in techniques in playful care so that maybe a blood draw turns into an enjoyable situation instead of a fearful situation. That time with the physician is they look forward to it versus they're scared of it. All of our staff here at Shriners are trained in pediatrics, so we're all definitely on the same page as far as making it the most enjoyable experience for the family.
Well, Amy, as a parent, I know how scary it can be to take your child to a hospital the first time or the 10th time, and many families take into consideration whether a hospital or care facility is in network with their insurance plan when it comes to selecting that place to receive care. So among all of the things everybody worries about, insurance is certainly a big one. What information do you give families who may be struggling to find a care facility that meets their financial needs?
That's a great thing about Shriners, and that's one of the things I like most about my role is that I get to tell families they don't have to worry about that piece. Shriners does accept all major insurance plans, but it's also not a barrier to becoming a patient here at Shriners Hospital in Portland. We have financial counselors that will work with families regarding their financial needs, whatever their situation may be. So they never have to worry about whether they have insurance or what type of insurance. We will care for their child regardless of that.
Well, right now, in these unprecedented times, we're in the midst of a global pandemic. And I'm sure many patients and families are apprehensive about visiting medical facilities during this time. Amy, tell us about the options for patients and families who may feel unsafe to make the trip to the hospital. How are you utilizing telehealth? And what would you like them to know about what Shriners Hospital for Children in Portland is doing to keep the visitors safe and the community at large?
Sure. So while some conditions do require that they come in person, we do want to assure families that we have worked diligently to keep our facility clean and safe in an environment in which they can be safe in. We've implemented protocols in temperature checks, screening questions for individuals entering the building for both staff and visitors alike. We've limited the number of people coming into the building so that we can provide the most care possible in person when needed. We've also, of course, implemented the fast-track video visits, also known as telehealth visits, and we have those reviewed by our physicians if a family feels that is more appropriate for them. So that decision is being made by our physicians as far as what is appropriate and what needs to come in person.
To wrap up, Amy, how does the Portland Shriners Hospital foster an environment that makes the patient and the family feel at ease?
We make sure to let families know to carve a couple of hours out of their day. I know that sounds long and grueling, but because we have so many options under one roof and we have not yet met their child, we don't know if the physician's going to order more imaging, if they're going to be meeting with our rehab staff, with our prosthetics and orthotics lab, if a brace is indicated for their condition. Perhaps they need to meet with one of our other staff, such as a child psychologist who's joined us now. We really have a lot of options. Again, the whole building is centered around pediatrics and pediatric-friendly care. We also have a walk-in fracture clinic where families don't even need to give us a call. They can simply walk in Monday through Friday from 7:30 to 4 p.m. That service, again, is for fractures and injuries. Although we are in the middle of a pandemic, kids are still active and some are still playing sports. So we are still here for them in that sense. We have kept that open through everything.
And you can call the new patient scheduling department at 503-221-3422 to get set up with an appointment or visit us online at portlandshrinershospital.org. Thank you, Amy, so much for joining us today. And that concludes this episode of Healing Heroes PDX with Portland Shriners Hospital. Please remember to subscribe, rate, and review this podcast and all the other Shriners Hospitals for Children in Portland podcasts. I'm Melanie Cole.